Thank you, Minister. I welcome this very important bill, the Patient Safety, Notifiable Patient Safety Incidents Bill of 2019, or to put it in more lay terms, the Mandatory Open Disclosure Bill. And I think it's been long overdue, but it is now very welcome, and I'm glad to see that patients will be entitled to get the full facts about their own medical tests and their own conditions and medical information. And they need to be able to trust that they are going to get that information, Minister. This will be, of course, a cultural change in the hospital sector, in our medical sector, in the clinical sector, but also a legal change. But there needs to be leadership within the HSE to drive that change. We've seen other policies and other laws change in the past, but perhaps not implemented in the manner that they should have been. As my colleague, Deputy Donnelly, stated back in 2016, the then Health Minister and now Taoiseach, Leo Varadkar, stated that he was opposed to mandatory reporting. In 2012, the National Healthcare Charter was published with open disclosure guidelines, but never fully and properly implemented. This bill aims and hopes to ensure that our health services learn from the mistakes and the errors to prevent them from ever being repeated. But also it's about the right to know. It's about the right for patients to know about their own bodies, their own conditions and bodily integrity. The World Health Organization has stated that 1 in 10 hospital patients experience harm, but at least 50% of these cases are actually preventable. It's very questionable whether we'd be here today at all bringing in mandatory open disclosure if it wasn't for the cervical check scandal. In May 2018, the emergence of a failure to disclose to affected women the results of cervical screening audit led to widespread and very understandable anger. Women were badly let down. Dr. Scally, in his report, was clear in his view that the system for dealing with medical errors in Ireland was not fit for purpose. He went on to say that patients in particular are left with no other option but to pursue legal action. He stated, to find out the truth of what went wrong, until that changes, we're not going anywhere. Litigation is the only option. I myself represented a number of patients as a barrister in medical negligence cases. And I know what it's like as a small legal team to go up against the might of the legal apparatus of the HSE. I've seen people who have suffered some very serious medical negligence in heartbreaking and stressful situations, very often willing to settle early in cases because they simply are not able to deal with the stresses of courts. I said yesterday in the discussion on the perjury bill that the vast majority of people in this country never go to court. The vast majority of those who do go to court find it extremely stressful situation, don't want to be there. So they don't. And to face that kind of might of those legal teams is quite phenomenal. Dr. Scally went on to say that the current system is deeply flawed. The legal system takes an error and converts it into an injustice and then converts that into a financial sum. But even then, it's for the lucky few who are able to withstand the might of the HSE legal system and can afford their own lawyers or can get lawyers who are willing to take on the case on a no-fault, no-fee basis. Dr. Scally also went on to state that the failure to inform patients about errors in their treatment within cervical check were catastrophic, and the catastrophe came about when rushed and botched attempts were made to disclose, as some of those disclosures were made in an appalling way. Today is the Universal Health Coverage Day by the UN. It calls for all citizens to be provided with affordable and quality health care. So I think it's very apt that this bill is being discussed here today, because this really is about quality health care. It cannot be quality health care without patients being informed about the health care they are in fact receiving. I want to touch on a very particular aspect that's not specifically dealt with in the bill as far as I can see, but I do think it's an important matter in terms of disclosure. We have a record in recent years of appointing unqualified non-specialist doctors to work as consultants. These are not trained to take up these roles. They haven't taken on leadership training. They are not on the Medical Council Specialist Register. Yet they are in treating patients. Patients who are not aware that these people holding themselves out as consultants are not so qualified on the Specialist Register. The vast majority of patients will simply take a consultant at the word. They hear that word consultant and they believe that that person has been through all the necessary training. A lot of people, I think, will be very surprised and very hurt and very concerned if they realise that the consultant treating them was not actually on a specialist register, had not completed their specialist training. As one senior nurse said to me, that you can have a junior doctor on one day needing a nurse to help them put a needle into an arm, and the next day they're suddenly leading an entire medical team in a hospital. And that's simply not acceptable. This is a real patient safety issue. And I think the question is, where you have a non-specialist doctor acting as a consultant, is that not a prima facie safety issue? And I think under one interpretation of this bill, should it not be a compellable situation that those consultants who are not on a specialist register would have to inform a patient that they are so not qualified? I think in December 2017, Minister, you alluded to that yourself, that probably should be the case, and I would like your views later on that today. But look, I welcome this bill. It is an overdue bill, but I am glad to see it is now happening. Thank you, Ciarán.
Thank you, Minister. Brown.